Hey gang, how's it going? If you're new around here, my name's Kathy Robinson Pickett, and I am the founder and director of Friends Together. And on our social media platforms, we talk all things Friends Together, Kathy Robinson Pickett, social justice, and lately a whole lot about mental health. And this is our third week for our Mental Health Sundays. And I have with me my husband, Troy. If you haven't met him yet, Troy, tell everybody who you are.
I'm Troy. So, I'm a psychiatric mental health nurse practitioner. I'm doing telehealth now. Been in healthcare about 34 years. Psych NP for the last almost 2 years. That's it.
That's it? There's a lot more, but that's enough for
I'm boring.
He is not boring. Today, I think we're going to talk about something that's personal to the two of us.
Yeah, so that is, as you can see, we're not,
Spring chickens?
yeah, well,
He's older, by the way.
just older chickens. So, when you get, and it can happen at any age, but, as you get older, your parents get older, the health, problems that come with aging, just affects all of us. And there comes a time for a lot of us when, we have to, I hate to say it like this, but become the parents. So, I'm going to turn 61 in a couple months. Kathy is not far behind. So about 10 years ago, my mom passed away. She was in her late 60s at the time.
But unexpectedly passed away.
Yeah, right. So about a year after that, we were checking on my dad. He was living alone. And when I was checking on him one day, he just says, "Can I ask you a question?" I said, "Sure." He says, "Can I move in with you?" I said, "Absolutely." I said, "So, when do you want to do this?" And he says, "Well, soon." I said, "Okay." Let me call the realtor and list the house.
But how shocking was that to you?
So it was shocking, but I didn't want him to see that.
Right.
And I wanted to do something about it before he had a chance to change his mind. Because, we know our parents, we know how they can be. And for him, that was a major thing to have to ask. And I didn't want for him to have to ask it again. We listed the house and it was sold within a couple of weeks, and he was here within about 4 weeks.
Yeah.
So, he's 82 now. It's been 9 years since he moved in. He's had some health problems, and, among them, lately, or the last couple of years, he's gone on to immunotherapy for a cancer. He's tolerated it well. He's just crossed the halfway mark, but he's having some side effects now that he's decided that he doesn't know if he wants to continue. He's decided that he doesn't. We have an appointment in about a week with the oncologist to talk about it. The thing is, he made the decision on the 10th anniversary of my mom's death to stop this. So, Kathy and I both support whatever he wants to do. But we just don't feel that was the day to make that decision. So we are going to have a consult with the doctor to have him go over the benefits, risks again with him. But a few weeks ago I went with him for an infusion. It was the first time I had gone with him. Kathy usually goes with him, but since I've been back working at home now, I try to go as much as I can. And I was a little taken aback by the way things work in what I saw as an assembly line. This infusion center it's amazing, but I saw a loss of patient-centered care. The PA came in and was talking to my dad, who can't hear. They had him fill out a depression questionnaire in the lobby, and I watched him as he's marking no to everything, and me knowing that that's not true. So when he handed it to the PA when we were back there, she just I guess they have to do this like every year or something. I
Yeah,
think
it's
that's a
not
new
something
thing.
that had happened
Right.
before.
Yeah.
You just happened to be there on the day that this was
Right.
happening.
I think that was because it was the year mark, and that's probably like an annual thing they have to do. So she opens it up as he hands it to her and looks at it and puts it off to the side. And it was the PHQ-9. It was the one for depression. And she didn't say anything. I said, so just so you know, I said to her, my dad didn't hear, even though he was sitting between us. I said, that's not true. What he put on there. He does have some depression. He's not going to tell you unless you ask. I said, patients are not going to tell you a lot of things unless you ask. I said, so that leads me to a question for you. We, in healthcare, we have to provide a patient with informed consent, going over the benefits and risks. But the question is, when you have a therapy that's supposed to last for 2 years, how often do you have to get that informed consent? And the more ethical question is, how often should you? So I asked the PA, I said, so my dad has made comments in the recently that he's not sure if he wants to continue this. The oncologist, the surgeon, everyone has told him, if the cancer comes back, it could be intolerable pain. He knows the risks. I said, so my question is, how often does anyone here ask him how he feels about the therapy and if he wants to continue? I said, so do you ask them periodically? Or do you use the original informed consent that you got from him over a year ago? That was not a question that she was very happy to hear. The look on her face said it all. And she answered in a way without answering, and I knew the answer. And I just told her, point blank, you've got to start asking him because this isn't right.
Well, and I think something important, I just interject here because this has been an ongoing thing, right? This treatment has been going on for a year, but previous to this, he was diagnosed with a cancer, had the surgery, did radiation for an extended period of time. So we are more than 2 years into this process.
Right.
And for me, I've been the primary caregiver, right? And those of you that know me know that I am going to do anything that my parents or Wendell need. And that's the way it is. But it was really perfect timing. It was accidental that you were there that day.
It was.
Because I fill out paperwork for him when he asked me to. Troy didn't recognize that his dad probably wanted him to fill that paperwork out. And so he made him fill it out. Like he just gave it to him to fill out. But he was looking at it. And I would not, even though I would have recognized some of the stuff he put down wasn't, in my opinion, true.
Would you have spoke up?
Would I have spoke up? And I've thought about that the last few days. Would that particular PA, because I've kind of built a relationship with her, I would have said, but no, I would not have even known to push the consent part of that conversation.
And I had no relationship with her.
Right, you had no relationship.
I'd never met anyone in that office. And as a matter of fact, when I started asking questions, she says,
"Where's your wife?"
So Troy's daughter is usually here. I said, that would be my wife. I said, I'm his son. And I said, you're going to be seeing a little more of me in the future. The face was priceless. But it was totally unexpected. But I think that a different perspective going in with someone to doctors' offices that need someone is really beneficial. Someone that can take a look at it from a different perspective. Like Kathy's been going in there for over a year, and
I'm emotionally invested in everything that's been happening the last 3 years because you have been working out of town 90% of the time. So I've been the one doing the day to day. And I think that does change your perspective in the way you look at things. Even back to when your dad said to you about moving in with us, that whole year, your dad had been seeing me twice a week. Every week we would go to lunch and we would go to breakfast. So one day a week we would go to lunch, one day a week we would go to breakfast. So I was there all the time, but you weren't.
Right. And I mean, maybe once a month, I think. I'm not, because I was working out of town then too. But it's, what was strange about it is that he hadn't mentioned anything, or Kathy had mentioned anything to me about it with all the time that she has seen
No,
him.
he had never
Nothing.
mentioned a word.
So that was all the more, I mean, it just caught me off guard, but in a good way. But everything worked out great. He's been here for 9 years. He's had problems with depression since my mom passed away. Some of it pretty serious. He has good days and bad days. He does take medication for it. He does not talk a lot about it, which
He talks more to me about it than you, for sure.
But he doesn't talk enough about it. But he does the best that he can. And we don't push any more than we see the need to. But this whole thing is based on the purpose of this is just to let everyone know that it's okay to go in with a loved one with them to their appointments, especially if they're vulnerable, if they can't hear or they can't understand what's going on, and don't be afraid to ask the questions that you need to ask.
Well, and I think what's so interesting for us, because Troy is an only child, and my parents, most of you know, live across the street from us, and they are 79, and their health has been teetering lately. And my brother is fantastic, but he's in South Carolina. So we really do have the three parents, and other conversations are fixing to hit us.
Oh, yeah.
The keys.
It's going to hit one of us.
It's going to hit him. There are some things you should always know your limits to. And I know that's not a conversation that I'm going to be able to have. We have three parents that are 82 and 79 and 79. All three are still legally able to drive and are really okay and able to drive. But really, of the three, my mother is probably the most physically best to be driving, but is the one that doesn't drive most of the time. And you don't agree? She's the one that doesn't bump things. Let's put it that way.
Oh, well, yeah. So I agree mentally. Physically, I'm not so sure.
Well, they bought a vehicle that my mom can barely climb up into now, so that may be true. Right?
No, I just meant her reaction time with her joint problems.
Yeah. So we know these conversations are coming, and we know they're coming for a lot of you too. And it's really good to figure out if you've got to role play those through or talk to your other friends that have been there.
But not just that situation. We don't realize, as our parents get older, what our roles are going to be. We don't know from day to day what our roles are going to be. But this is just to let you guys know that just basically what our situation is now, and it's not uncommon. And we have to be the advocate for our parents as patients, as parents, as people.
And conversations that if your parents are younger, start having them now. I kid with my kids all the time because Lord knows. I always tell Garrett, listen, you have 100% permission. If I get to the place that I need to be in a facility, you do that. but you better be sending me Uber Eats every day because I am not eating the food in the nursing home. So, that's funny, right? But it opens the door for us to have those conversations. Sometimes you have to open those doors little by little, right? Yeah. And you don't have to have that super serious thing in the beginning. It can evolve. And we've been fortunate. The two of us are incredibly fortunate that during COVID, literally, Troy was gone almost all of COVID working, but I had my mom and dad and Wendell here. We were all in the same bubble. And we're just close enough to be able to do what we need to do. For those of you that may not live in close distances to your parents, know that doctors will do speakerphone with you. They will Zoom with you. We've had to take Wendell to Miami in the middle of COVID, and those doctors down there were incredible. They just Zoomed all of his appointments with me in the parking lot. So ask for those things if you need to.
Yeah, and for people that work like I was working in places that were very high risk for the transmission of COVID and everything else, sometimes you have to make a difficult decision of coming home less because out of fear that you're going to bring something home to the people who have older, mature immune systems.
Or compromised immune systems. It's pretty amazing. Those of you know, I had COVID a few weeks ago, and it's the first time. And Troy was a frontline healthcare worker all the way through COVID. But that we made some tough choices, and we kept our parents safe, and he kept me safe, which, it doesn't mean that other parts of our life didn't suffer from that, because they did. And so now we're making up for some of that too. Somebody sent me a question yesterday, and I didn't even tell Troy I was going to ask this question, but I'm going to end with it. And somebody that knows us said, so how's that transition going for y'all? And, it is a big transition. We've been married 16 years. We've known each other almost 40. We lived together in the past. We lived together before we got married this go around. But in all that time,
in the last 10 years, I haven't lived here.
He hasn't lived
full time.
More than 4 or 5 nights a month. I mean, we haven't even had a vacation in the last 6 years where we've been together for like 2 weeks. So, are we having transition ourselves? We are, but it's not bad, right?
No, it's going well.
I think we're going to be able to make it in our 80s. I didn't used to be sure
of that.
Early
70s.
I wasn't always sure of that, but I think I am. So what I want to say is life is always a transition.
It is. Working from home now is a big transition from not being at home, and there has to be some trade-offs, and I am doing pretty good with that so far.
And he's cooking.
I'm cooking
a lot. It's great.
And my dad has actually gone up from double-digit weight to triple-digit.
He has. He's gone from about 97 to 102, 103, which
is amazing for him.
Amazing in a month. 6 pounds in a month is amazing. So anyway, keep those questions coming. We got a lot of them from you this week, and hope to get more this week. And well, definitely, if you got a topic you want us to talk about, let us know. And
this isn't the typical mental health discussion, but we thought that this was something that we need to put out.
And that's the things we want to talk about, is the things that we're going through and the things we think you guys are going through too. So have a great week, gang.